Hello everyone, welcome to the series on dental trauma. Today we will discuss about avulsion. As discussed in the previous video, the International Classification of Diseases to Dentistry and Stomatology classified injuries to the periodontal tissues into 6 groups: concussion, subluxation, extrusive luxation, lateral luxation, intrusive luxation, and avulsion. In avulsion, there is complete displacement of the tooth out of its socket. It represents a true medical emergency, and the prognosis is highly dependent on the immediate actions taken at the place of incident. The immediate management involves keeping the patient calm and finding the tooth. The tooth should be picked up by the crown and touching of the root should be avoided. If the tooth is dirty, it should be rinsed gently with milk, saline or patient saliva. The tooth should be replanted gently to its original position. And the patient is advised to bite on a gauze or napkin to hold the tooth in place. If it is not possible to replant the tooth immediately, such as in case of an unconscious patient, the tooth should be kept in a storage media to prevent dehydration of the root surface. The recommended storage media includes milk, Hank's balanced salt solution, saliva, saline and water. In both cases, whether the tooth is replanted or not, the patient should visit the nearest dental facility for further management. Now coming to the definitive management, the treatment of choice depends on the maturity of the root, that is an open apex or a closed apex, and the condition of the periodontal cells. The viability of periodontal cells depend on the extraoral dry time and the storage media. If the extraoral dry time is less than 15 minutes, the cells remain viable, while the health is compromised if the time is less than 60 minutes. And if the time is more than 60 minutes, the cells become non-viable. Now, if the tooth is replanted immediately or the extraoral dry time is less than 15 minutes, the injured area should be cleaned with water, saline or chlorhexidine. The correct position of the replanted tooth is verified and any repositioning required is done. The tooth should be stabilized using a passive flexible splint for 2 weeks. A more rigid splint for 4 weeks is recommended in case of associated alveolar fracture. Any gingival lacerations present should be sutured. In case the extraoral dry time is less than 60 minutes, irrespective of whether the tooth is kept in a storage medium or not, the avulsed tooth should be checked for any contamination and cleaned with sterile saline. The tooth should be kept in a storage medium during examination and treatment planning, and local anesthesia is used if necessary, preferably without a vasoconstrictor. Then, the alveolar socket is irrigated with sterile saline and examined carefully. Any alveolar fracture is repositioned and coagulum formed in the socket is removed. The avulsed tooth should be replanted gently with slight digital pressure and the position verified. The tooth is stabilized using a passive and flexible splint for 2 weeks. A more rigid splint for 4 weeks is recommended in case of alveolar fracture. Any gingival laceration that is present should be sutured. Now, coming to delayed replantation after 60 minutes. It has a poor long-term prognosis since the PDL fibers become necrotic and expected to degenerate. The expected outcome is ankylosis-related replacement root resorption. The goal in such cases is temporary restoration of aesthetics and function while maintaining alveolar bone height, contour and width so that future treatment options are open. The steps of management are similar to those discussed previously in case of extraoral time less than 60 minutes. Some contraindication to replantation includes severe dental caries, severe periodontal disease, uncooperative patients, severe cognitive impairment during sedation, severe medical conditions such as immunosuppression, and severe cardiac conditions. Now, coming to the antibiotic therapy in avulsion. Systemic antibiotics should be prescribed in all cases to prevent any infection. Amoxicillin is the drug of choice because of its effectiveness on oral flora and lack of side effects. The effect of topical antibiotics applied on the root surface prior to replantation remains controversial. The endodontic treatment is dictated by the maturity of the root. In case of closed apex, it is recommended to initiate root canal treatment within 2 weeks post replantation with calcium hydroxide dressing for 1 month followed by obturation. In case of immature tooth with an open apex, spontaneous healing can occur in the form of new connective tissue with vascular supply. However, in cases where spontaneous revascularization does not occur or there are signs of pulp infection and necrosis, root canal treatment is to be started as there is risk of external infection related inflammatory root resorption. At last, the postoperative instructions to be given to the patient includes avoiding participation in contact sports, soft diet for up to 2 weeks, regular cleaning of tooth after each meal with a soft toothbrush, chlorhexidine mouthwash twice daily for 2 weeks. Also, the patient should be informed about the prognosis and potential cost and time required for different treatment options. That's all about avulsion. If you find the video helpful, then like, share and subscribe to our channel. Also, you can download our app for more details and notes on dental and medical topics.